right, 25 minutes before 10 o'clock. Thank you for tuning in. Nice looking Monday morning. Hope you're doing well. Right after the big 4-day break, if you took advantage of all 4 days. Robin and I didn't take it. Well, we did actually. I mean, it's kind of fun coming into the studio and doing the show on Thanksgiving because it's a different kind of a show, you know.
Yeah, it is. It's very, very nice.
Do you know, Robin had a really close call. Robin's husband did, but cancer affects everybody, and Robin's husband lost an entire lung. His left lung was removed because it was cancerous, and now 5 years later, he's doing well, which is wonderful. Carol Ann Baldwin's husband, I hope she doesn't mind me saying, who's our lady who does the gardening show on Tuesdays. I'm mentioning that for Dr. Reynolds' benefit. Her husband recently had a part of the lower lobe, I think, of one of his lungs removed because of cancer. The word cancer is simply scary. I don't know if attaching an organ to it makes it scarier. Does lung cancer sound scarier than liver cancer? I don't know. It all sounds scary to me. Dr. Craig Reynolds is in the studio. He is an oncologist at the Ocala Oncology Center. I've been there. I used to work for an assisted living facility. I used to take clients there, and my own mom had gone through cancer as well. The Ocala Oncology Center is an affiliate of the Florida Cancer Affiliates, according to this. Dr. Reynolds is also a lecturer. He's active with youth groups and an avid bicyclist.
I love that part.
It's the only part I can relate to. I haven't done it in a while, but I love that. Good morning, Dr. Reynolds. Thank you for coming in. Nice to see you.
Great to be here.
And you live in Ocala?
Yes.
All right. Excellent. Well, thank you for, you know what? We have an interesting opportunity, the two of us, because we get to speak to a lot of authors. They're not usually in the studio. They're usually on the phone. And when we have an author who has written a book that has an answer to cancer, we often will have another guest, another author, sometimes the same day, who contradicts the first one. And you say, well, who's right? Sometimes they'll say, stay away from meat. Sometimes they'll say, change your, what is the pH thing called?
Oh, gee, we just tested
acid
it too.
And alkali and
Yes.
That's it.
Change that. So you're here, and now we get some straight answers.
Yeah.
Yeah, everyone wants an easy answer.
Yeah.
And unfortunately, there's a lot of people out there who feed on desperation. And there are a lot of pseudotherapies out there. And there are people who say that conventional medicine is hiding a cure from cancer.
I know.
Which is silly, because whoever were to find the cure with a capital C would become famous and rich. And what else would anyone want? And nobody who cares for cancer patients would hide a cure, because I think most of the people in the field fall in love with their patients, and there's a very close bond between physicians and patients that I think is unique to oncology.
Well, thank you for saying that. We actually had a guest. He was in Canada, and he said that he had the cure, and it was some kind of a wave machine. Okay, he was. Have you ever heard of this, the wave machine?
I've heard of similar things.
Okay,
yes.
And now I'm not the one to say. I'm just saying that he said he had the cancer, and exactly like you said, he said conventional medicine is hiding it because they make money from it. And I said, well, there's got to be at least one doctor who would blow the whistle. There's got to be at least one who would say, no, this works.
Yeah, that's exactly right.
Yeah. I mean, I can't believe everybody would be on board this whole conspiracy to keep it from us all. But with that said, though, how are we doing compared to like 10 years ago, 20 years ago?
Yeah, I think things are improving dramatically, particularly in lung cancer, which is kind of a focus this month. This is Lung Cancer Awareness Month, as I'm sure you know from your own personal experience. And things in 20 years compared to when I started really have changed very dramatically in the treatment of lung cancer and other diseases. Still would be best not to ever have the disease, but for patients who have the disease, our treatments now are way more effective than they've been in the past.
If other cancers metastasize on the lung, is that worse than lung cancer?
It's different. So patients always talk about cancer based on where it started. So if a woman, for example, had breast cancer and her breasts were removed, she might say, well, now I have lung cancer when her cancer spread to her lungs. But a physician would say that's breast cancer that's now in the lungs, because that determines prognosis and treatment. And really, where the cancer started has the biggest impact on prognosis of anything, rather than where it happens to be.
So does that change the treatment?
Not usually. Really what determines the treatment is where it started. So for example, if we had a patient who had breast cancer that had spread to the lungs, the treatment would be completely different from a primary lung cancer.
Have you ever had a patient who tried one of the alternatives and you were surprised at the results?
No.
No, okay.
Quite honestly, there are always patients who do inexplicably well with standard treatment. I have a few patients who had incurable cancer that I cured somehow in ways I don't quite understand. But when I have a patient who's interested in alternative medicine, I always encourage them to do it in conjunction with standard medicine. And if I have someone who just is adamant that all they want to do is try alternative medicine, I'm always willing to follow those people to really see if they're responding. Unfortunately, when I've had patients who've done that, it hasn't really helped them.
Can we develop lung cancer if we've never smoked?
Yes. So although cigarette smoking is the biggest risk factor, as you know, for lung cancer in non-smokers can occur, and the incidence of lung cancer in non-smokers is rising for reasons we don't understand.
Is it culture a thing? Like in America, we have maybe, I don't know, carcinogens coming from the cars. Like could you do a study in a country where there are no cars and see that the lung cancer rate would be different?
Yeah, we think environmental pollution probably is a risk factor. For example, if you go to Asia, where there's certainly a lot of smoking, but a lot of lung cancer in non-smokers, but really terrible air quality in a lot of the cities,
right.
There is more lung cancer in non-smokers. Some of that may be genetic predisposition as well.
Well, I appreciate that you're here, and we're going to learn from you. So one of the things we have a question about is a term it's easy to read. It's not one of those hard medical things, but it's non-small cell lung cancer. What is that? Non-small cell lung cancer.
Non-small cell lung cancer is the most common type of lung cancer. There's another type called small cell that behaves differently and more aggressively. So about 85% of lung cancer in the United States is non-small cell lung cancer.
Okay, so the cancer cells themselves have different sizes.
Yeah, in the old days, it was all based on light microscopy. And so now we do it really by genetic testing primarily in special stains. But we're victims of our history like everything else, so we still use the old terms based on light microscopy days.
Is that right? Now, I had on my nose, I had a little bump, and it turned out it was a skin cancer, and I was told it was the best type. If Robin was still in here, she could tell you what it was called. I can't remember what it was called now.
Probably basal cell or squamous even.
I think basal, and then squamous was the next worst one, and then melanoma was the worst that I could have had, right?
That's right.
So there's three different categories of skin cancer.
Right.
Is that the same thing as what we're talking about with lung cancer?
Yeah, with lung cancer there are different types, and even in non-small cell lung cancer we now differentiate adenocarcinoma, which is a type of non-small cell lung cancer, from squamous cell cancer, and even within those diseases now there are genetic subtypes of disease as well. So as we become a little bit smarter, it becomes more complicated.
I don't know if you heard the last thing we did, but we were talking about people who have an interesting immune systems, and one of them was a group of dwarf people. I can't remember where it was now, South America maybe, and they never ever get cancer. And the article suggested that there might be a clue in those people as to what we can do to cure cancer. I heard the same thing about sharks. The sharks never get cancer.
That's right.
Is that right?
Yeah, so the immune system is very important in cancer, and one of the exciting advances that we have in lung cancer and other diseases are immunotherapy drugs, which have really dramatically changed outcomes. Probably the most exciting thing that I've seen in 20 years taking care of cancer patients.
Oh, really? And will that replace the chemotherapy and the radiation?
Right now it's hard to know. Certainly it's going to at least supplement it, but for example, for patients who have metastatic lung cancer, so lung cancer that's already spread, a study was recently done in which they either got the standard chemotherapy second or immunotherapy, and it was clear that immunotherapy was much better than chemotherapy. Very exciting, particularly because there's a group of patients that does very well and has long-term disease control that we really don't see with chemotherapy.
Doctor, we have to take a little break. We've got the weather and a few commercial announcements. Dr. Craig Reynolds is with us, and if you are okay, we'll take phone calls from listeners.
Sure.
Okay, the phone number to call if you want to be on the air with Dr. Reynolds is 622-9622. We'll take a break and be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident for Monday times of clouds and sunshine. High 78 to 82. And partly cloudy Monday night. There may be a shower along the coast. Low 64 to 68. Tuesday times of clouds and sun and warm with a shower or two in the area. The high 79 to 83. Wednesday mostly cloudy with a chance of a shower. High 80 to 84. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Hello, gorgeous.
Hi, this is Becky at Hello Gorgeous Salon. Let's get rid of those sun-damaged ends and faded out color and get into something rich and vibrant. It's time to get that new look started. So call today and set up your appointment at Hello Gorgeous Salon, 351-5358. Hello Gorgeous is a certified Brazilian blowout salon. We can tame those locks, leaving your hair healthy and shiny with a Brazilian smoothing treatment. And whether you're going on a job interview or out on a date, your hands do a lot of talking. Manicures are a must. Hello Gorgeous is a full-service salon, so let us help you make a great first impression. Call us today to set your appointment at Hello Gorgeous. Our number is 352-351-5358. Again, that's 352-351-5358. Hello Gorgeous is conveniently located in the heart of downtown Ocala, right next to the historic Marion Theater. And don't forget, we also do men and children's cuts too.
Hello, gorgeous.
If you're anything like I was, the thought of getting older was the last thing on your mind. But here we are. For me, it started slowly. The lack of energy. Never being in the mood. And when I was, I could never perform at my best. I tried the pills and other treatments with minimal results, and all but given up on my sex life. Then I found the doctors at New Male Medical Center. Wow, they made a new male out of me. Feel like I'm 25 again. I have renewed vigor, so much more energy, and no longer worry about my performance. New Male treated me like my situation was one of a kind, with a custom treatment plan that really works. I feel great. They can create one for you too. It does not matter if you suffer from low testosterone, erectile dysfunction, or just want to last longer. New Male will help you.
Call New Male Medical Center today at 352-404-4779. 352-404-4779. That's 352-404-4779. It will change your life. 352-404-4779.
PPIR is a networking group formed to serve the realtor and small business community. It primarily serves the real estate and construction industry, but is open to all businesses that provide any service or product to the real estate business community. PPIR has no membership dues or fees for attendees. The watchwords are keep it simple and maximize networking time. PPIR chapters generally meet once a month after business hours. For the information on this, call 352-615-9412 or go to events@ppirevents.com. PPIR, professional people in real estate.
All right, 12 minutes before 10 o'clock. Thank you for tuning in. In the studio with us is Dr. Craig Reynolds. He is an oncologist at the Ocala Oncology Center. He also is a bicyclist, which we didn't even get to yet, but we will. I'll make sure I squeeze that in somewhere. But you know what? Let me squeeze it in right now because I was wondering, because one of our other guests said that sometimes one of the best things you can do. Now, this guy seemed like he was more legit than some of the other ones.
Oh, yeah.
And we always let the listeners know. We always let them know, hey, take this with a grain of salt because we don't know ourselves. We're just radio hosts. This guy sounded more like you. I mean, he sounded more level-headed. And he was saying that exercise sometimes combined with the normal treatment can make a big difference. Have you seen that too?
Yeah, that's true, and it's actually been studied in breast and colon cancer, where a couple studies have been done for women receiving adjuvant therapy in breast cancer, where women who get regular exercise actually reduce their risk of recurrence by about 30 or 40%.
Is that right?
So it's a huge benefit, and again, that probably has to do with stimulating the immune system, which we know exercise does. So it's really an interesting phenomenon, and what makes me believe those studies is they weren't done by like Prevention Magazine. They were done by reputable scientists who I know really did them with the intent of getting their patients to shut up about diet and exercise, and it turned out the patients were right.
Oh, that's interesting.
Oh, my.
Oh, okay. So the nuts in your world are the magazine people because they're looking for an angle or maybe to sell a product or something.
No, and I don't mean to single out Prevention Magazine. It's actually a decent magazine. But yeah, I mean, I think that I always believe something when I know it goes against the bias of the person who reports it. So in that case, I know that was the case.
And so you bicycle?
Yes.
How far do you bicycle?
It varies, but in a typical year, I'll do about 6,000 or 7,000 miles.
Wow.
Whoa. What about a typical weekend?
If I'm not on call, I'll usually do 50 or 60 miles a day.
You wear the spandex?
A day?
You wear the uniform, the spandex and all?
Yes, I do.
Oh, that's cool.
Day? Did you hear, Robin? A day.
I know. I was more interested in the spandex.
I know. I heard you. All right. There's something called Opdivo that I think we need to mention. Is it a pharmaceutical? What is it?
Yeah, it's one of the new immunotherapy drugs, and we played a role in some of the clinical trials that led to the drug being approved. And it's really a very interesting story. One of the things we've come to understand is that cancer hides from the immune system. So in our bodies, we have cells called tumor-infiltrating lymphocytes. You can think of them almost as like Pac-Man. And Pac-Man will go into the tumor and just chew it up and kill it. It's really impressive. And the power of our immune system when it's there is really incredible. But one of the things we've learned is some cancers will express proteins that tell these cells, the little Pac-Man, it's okay, I'm supposed to be here, and they go into a resting state. So if you look carefully under the microscope, you can see those cells, and they're sitting there on little chase lounges, and they have little drinks, little umbrellas in them.
I love that.
And what drugs like Opdivo do is turn these cells back on so that they can do their job. It kind of takes the ability of the cancer to hide from the immune system away. And the results have been exciting. We see patients who have long-term responses to immunotherapy, some lasting years. So it's very exciting and something we haven't seen. What we want to do, though, is understand why some patients don't benefit and how we can get every patient to benefit. So we're in the early days with immunotherapy, but I think over the next 10 years, that's going to be where we're going to make incredible progress in the treatment of lung cancer. It's not just lung cancer. These drugs have activity and have been improved in kidney cancer, in bladder cancer, and several other, and melanoma, the bad form of skin cancer we were talking about earlier as well.
Would it be something you would have to take for the rest of your life?
We don't know the answer to that. So when the drugs were developed, the idea was to keep patients on them until progression. And the drugs worked better than anyone expected. So now the question is, if patients are on the drug and they've been on it for a year and a half and they're doing great, do they need to stay on it? So we're actually in the process of doing a study where patients who are doing well after a year are randomized to stop or to go off treatment. And that study is still in progress, but we're really trying to understand the answer to a question that nobody anticipated when these drugs were first developed.
When you do studies, do you do different studies for children and for middle-aged people and for more mature people?
Yes, because pediatric oncology is really its own field, and so we don't see patients in that age group. But pediatric oncologists have always done a better job of putting their patients on clinical trials than adult oncologists. I think that's one of the reasons that kids with cancer do better than adults, and that's something we're trying to change by helping to get clinical trials out into the community in places like Ocala to make it easier for patients to go on studies so that they can benefit from new treatments like Opdivo.
So that this is, I'm guessing, this conversation right now will get some people asking their doctors for Opdivo, but that won't happen just by asking, right? You have to...
Well, the drug has now been approved.
Oh, okay.
So, yeah, and patients should always ask about clinical trials, and I think most oncologists are aware when there's a new treatment where to send patients to get a drug that could make a difference for their patients.
Wow.
Do people usually get diagnosed by their general practitioner and then they come to see you, or are you also a general practitioner that you can diagnose?
We do sometimes make the diagnosis ourselves or have a patient sent to us because the referring physician thinks they have cancer. More commonly, we see a patient who's already had the diagnosis established. In the case of lung cancer, commonly after they've seen one of the pulmonologists who are lung specialists who have either done a bronchoscopy or set up a biopsy to establish a diagnosis of lung cancer.
And is it better to, when you do these tests, that you tell the patient alone that they have a cancer, or should family members be present?
I think it's always great to have family present because it's an emotional support. And a lot of times what happens, we tell a patient they have cancer and their brain just starts saying, oh my God, oh my God, oh my God, over and over again. And they don't really hear anything after they hear the word cancer. But if there's some family members with them, they hear what you have to say, and so then they can kind of reinforce it with the patient later.
Doctor, you have a phone call. Let's take that call. Good morning. Thank you for waiting. You're on the air with Dr. Craig Reynolds.
Yes, good morning, doctor. Like with prostate cancer, a hereditary factor is pretty strong. What about with lung cancer?
Yeah, certainly there are hereditary factors. We understand that there are some families who have some genes that perhaps they're less likely to get cancer-related lung cancer or smoking-related lung cancer, for example. We don't understand the underlying genetics of lung cancer very well as of yet, but I think over the next few years that's likely to change.
Oh wow! So the things that we hear about and we try and put two and two together. Do you see maybe 10 years from now where cancer is going to be like polio was? Where we say it used to be. Do you think it's that soon, 10 years?
I don't think it's going to be quite that rosy. I think, when Richard Nixon declared war on cancer, everyone thought we were going to find the cure with a capital C, and we've learned how to cure some diseases. I think for other diseases, we're learning how to turn cancer into high blood pressure, which is what nobody really expected to have happen. So there's a lot of patients, we can't cure their cancer, but we can keep their cancer under control so they can get on with life for a long time. Mm-hmm. And I think that's, what was unforeseen when this process started, that we would turn cancer into a chronic disease for a lot of our patients.
Lung cancer is the primary focus today. Does it always have to be cut out, like in the two cases that we know personally?
Most of the time for non-small cell lung cancer, which is the most common form of lung cancer, if it's caught at an early stage, surgery is the treatment of choice. There are some new radiation techniques that are being developed that may ultimately replace surgery, but we don't know that at this point. Unfortunately, for non-small cell lung cancer, when it's diagnosed, most of the time it's already spread, and then those patients usually don't have surgery and are treated primarily with chemotherapy and now with the emerging immunotherapy. The other type of cancer, lung cancer, called small cell lung cancer, is usually treated with chemotherapy or chemotherapy in conjunction with radiation.
I've always heard that people, from the day they're born, they always have these cancer cells in them, but they're always dormant until something kicks them off. Is that a myth or a fact?
We don't really know, and probably that's not true, but we think that there are times that cancers develop and the immune system takes care of them, so the person never knows they had an abnormal cell that the immune system cleared, and that probably happens most of the time. It's just sometimes the abnormal cells escape the immune system for whatever reason, and then later on will grow and cause problems for the patient.
If the chemical in chemotherapy weakens the cancer, and if the drug in Opdivo strengthens the immune system, can those two things be used together?
Well, that's one of the things we're working on right now. So that's a really brilliant question, and we're starting to do combinations. And we think that ultimately either combinations of different immunotherapy drugs as we get better at it, or combinations of other drugs that are anti-cancer drugs with immunotherapy may improve outcomes. And that's really the focus right now in lung cancer treatment and also other diseases.
The fact that we've only got a few minutes, less than 2 minutes left, the one thing I want the listeners to know is how to get more information. This is a super serious topic for anybody going through this right now, so I apologize to the listeners. It's just a radio show. We can only scratch the surface, maybe not even in this case. Do you have a way they can get a hold of you or a website you can recommend?
Yeah, so our office phone number is 352-732-4032. We also have a website. You can either look up FCA Ocala or Ocala Oncology, and it should come up. And then there are a couple of really good websites. One is cancer.net, which is run by ASCO, which is the big professional society in oncology. And then there's another one called PDQ, which is run by the National Cancer Institute, that has great information about almost every type of cancer.
Okay, for the listeners who didn't get all that, don't worry. Robin will put it all on Facebook, and we'll also put this interview on Facebook and YouTube. You can share this. But if you could just real quickly just say a little slower the phone number. 352-732-4032. Okay, excellent. And as I was saying, the interview that we just did with Dr. Reynolds will be on YouTube and on Facebook this afternoon. Share it with somebody you love. This could save their lives. They'll have some information on what to ask their doctors. Dr. Craig Reynolds, thank you for taking time out of your day. I know you have patients to get to.
Thanks.
That was a great interview. We will take a little break. We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Fox News Radio, I'm Pam Puso.